Now, welcome back. Hope you had a short but nice break. There will be a larger lunch break soon, so no worries about that. We'll proceed now with another impulse speech by Mirit Eldor. She's the Executive Vice President Strategy at Elsevier, coming from London. So please enjoy that session with her. It'll be approximately 50 minutes, followed by 5 minutes of questions. So thank you, Mirit.
Thank you. I'm very excited to be here. So yes, I'm executive vice president for strategy at Elsevier, but I also have two additional roles, which are really the reason I'm here. I'm executive sponsor for gender at Elsevier, and I've also helped set up, and I'm currently serving as secretary of our IND advisory board. So I can't tell you how delighted I am to be here today. And you might be thinking, why is she here today, actually? Elsevier is a publisher. How do they help advance inclusion and diversity? Well, we are a publisher, and as a publisher, we realize that we have impact on academic careers that we can use for the good. We're also an analytics provider, and we're also a digital health company. So actually, I'll give you 3 examples of how we can help. We can help improving representation in academic publishing. We can help improve the inclusion of the sex and gender dimension in health and research that we publish. And we can help not just clinicians and researchers. By that, we can even help patients. And we can help by elevating the awareness, by doing analytics, using the data that we have and our analytical capabilities to publish reports and to share where we are today in terms of inclusion. So I'll talk a little bit about some of these things. But I should start by saying, whatever we do, we don't do on our own. We work with our communities, with researchers and other academic stakeholders, with funders, with policymakers, and with other organizations. We even work with other publishers, increasingly. And so a few examples on this page are the gender summits, where since 2011 we've been involved and contributed to those. There's the Inspire. This is last month. I joined Inspire IND conversation, thinking about Inspire is a Horizon Europe initiative to improve inclusion and diversity in research. And the joint commitment, this is an initiative where 56 publishers have come together to talk about, not just to talk, but to also execute on how we can improve inclusion and diversity by pulling our resources together. Across the publishing industry. So these are just some examples. I'll start with some data because I'm in strategy, right? So why did we start with gender? And we are actually focusing on other dimensions of inclusion and diversity as well. But gender, of course, is the most pervasive. 50% of the population are women. 50% of people in academia are women. But, of course, as you can see from this slide, and the leaky pipeline has already, of course, been mentioned, this is a relatively fresh data that we pulled for today, which shows gender diversity and how it evolves over time from the date of the first publication. So on the left, you'll see the more junior researchers early on, and then going to the right, you see the level of seniority going up, and probably all the way to the right, 20 plus years since the first research publication, the proportion of women is already only 25% of researchers. And that's probably where tenured professorship kicks in, right? So 25%. This is the picture for STEM, but actually we also ran this analysis across all research fields, and it was still 28%. The next slide actually looks at funding. And this is an NIH example. They published their funding data. The NIH operates, of course, in health and medical, which is a relatively gender-balanced field. And this looks, on the left, at research grant awards given by gender in 10-year increments. So in 2019, again, in orange are women, about a third of grants were given to teams led by women. About a third. This is great progress because 20 years ago it was only a quarter. So we're at a third. And then when we're looking at the grant funding, on average, a grant given to a team led by a woman would be about 10% lower than grants given to teams led by men. So that contributes further to the depletion of funding given to women to around 30%. I have another example, a European example this time, from the UK, and this is engineering and physical science. Again, this is probably the biggest funder in the UK, with about $1 billion of funding every year. And here you can see on the left the gender split in engineering, which is low for women, only 17%. The next one looks at representation on peer review panels for women, which is actually on par with the 17%. It's somewhere between 15 and 20. But then look at the grants awarded. Only 7% of grants in engineering and physical sciences are awarded to teams led by women. And then the value of these grants is even lower than the NIH example. It's more than it's 60% less. So overall, only 3% of funding in engineering and physical sciences goes to teams led by women. Isn't this shocking? Shocking. So we saw this data, and we asked ourselves, what can we do about this? And I have to say that there are people at Elsevier who have been for many years, longer than a decade. I mentioned the gender summits, and actually Ilan sitting here, who is director of the Elsevier Foundation, was already then trying to push and see what we can do. But we also had a change at leadership at Elsevier. In 2019, we had a new CEO come in, the first woman CEO of Elsevier ever in 140 years. And then quite a few of us on the executive team have started also around that time. And Kumsal, our CEO, said she wants I&D and the impact that we can make on I&D to be her legacy as a leader. And many of us are also very committed to that. So we really took this on as something that we want to try and influence and use our power, our position. I mean, we published nearly 20% of scholarly research to try and do some good. So what have we done? So in 2020, in early 2020, we set up our External Inclusion and Diversity Board. It is co-chaired by our CEO, Kumsal Bayezid, and Richard Horton, who's editor-in-chief of The Lancet. And we're very fortunate to have 10 amazing gender trailblazers, shall I say, who agreed to join us. And really the role that this board plays is they help us understand and prioritize what we can do, what we should do. But it helps to hold us accountable. They are thought partners to us, but they are a board, they steer us, and we report back to them. And so it's been just over 3 years since we set it up, and I'll share with you some of the outcomes so far. And the 3 areas that we have decided to focus on with the board are, number 1, improving the representation and participation of women in the research ecosystem. That's our world. Number 2, embedding the sex and gender dimensions in research. And number 3, trying to help career progression of women researchers in academia. And one other thing I should mention here is that very quickly our board members said to us, it can't just be about gender. And that was already mentioned here more than once today. It has to be also other dimensions of intersectionality, because a woman who's also a person of color, who's also from an African country, will have a much harder time. So we have prioritized, in addition to gender, we're focusing on race and ethnicity, geographic location, and career stage. So under these 3 areas, there's a number of initiatives that we always have going on, and I won't go through all of them. These are some current examples of what we do. I'll just touch on maybe a couple on each of these boxes. And then I'll move to talk a little bit about where we are today. So underrepresentation, I already mentioned editorial boards. That is something we really want to impact. When we started, we didn't actually have data to look at this until maybe 4 or 5 years ago. And when we started collecting the data, we realized that only 15% of our editorial board members are women. And Elsevier has more than 2,800 journals. So we have a lot of editors on board, and we can really make impact if we fix this, we realized. So editors, number one, reviewers, also a more balanced, more equitable reviewer pool, and then conference speakers. Those were the three areas we prioritized. And then data collection, because the data is so poor. And so we're driving data collection on this column, and that's where I'd also put the collaboration with the 55 other publishers, because if we all collect data in a consistent way, then we can start doing analytics across the entire sector, and that will be very powerful. Number two, embedding sex and gender in research and health content. So here, a big focus for us was the sex and gender guidelines. How to include sex and gender dimensions in research. So we have the guidelines, we're doing training, we're doing all that we can to really embed that thinking from the research design phase, working with both editors, reviewers, and authors on that. And then we've done content reviews to remove bias, but also it's wonderful to see how this thinking is also trickling down into our product teams, and we're increasingly building more inclusive products that take that sex or gender into account, depending on the context. So for example, we have a lot of anatomy books, anatomy atlases, Netter and Gray's, but we realize, and some digital products, we realize that no one has ever actually built a truly female anatomical models. In all the anatomy books until today, the anatomical models was based on a body of a male, and then the reproductive system was put in. So the dimensions, the proportions, it was just not right. And this is what doctors, this is what medical schools use, this is how people learn. And so we have built a 3D anatomical models for women. We've launched it last year, and already about 20% of medical schools worldwide use it. Isn't it amazing? It's wonderful to see that things go into practice and will actually impact medical behavior. So that's on this one. And supporting career progression. So here the Elsevier Foundation has been really a wonderful vehicle for us to partner, because this is all about partnerships and going deeper into the communities. And of course the gender reports, which I mentioned before, which where we supply evidence basically that can then lead to discussion, and often does lead to discussion on what's right and where we need to be. Okay, so I'll share with you some of the outcomes, bearing in mind it's been 3 years since this started, but longer, since many of my colleagues started driving initiatives. So this is the, as you can tell, topic close to my heart, women on editorial boards. And on the right is really our full portfolio of journals, the 2,800, and you can see how we moved from the 15% that I mentioned to 29%, actually 30% so far this year. So we've doubled the number, which is great. We're not where we want to be yet, but we're making really good progress with a combination of initiatives. And I can tell you, because we started before the board, that this was not an easy one to move. But we had a combination of strategies, from asking people to actually step down or retire early to make space for more diverse boards, to whenever we have now a new journal and we set up a board from the beginning, it's gender balanced, to creating programs for young researchers actually for 2 years, which then lead to an editorial board position. So we've deployed a combination of strategies to get there, and I'm very proud that we have made this progress. But of course, looking at the Lancet journals, the Lancet tends to be ahead of the curve at Elsevier. It's really impressive to see how they're already at 50%. Next one is conference speakers. So here we did actually have data early on. We asked conference participants to share data, demographic data with us. So when we looked at the data, we saw that when it comes to conference participants, it's about 50-50, gender balanced. But when it comes to speakers, 17% only were women. So this was a concentrated effort. Oh, I moved too much. Where our conference leader has worked with organizing committees and with conference directors to to drive this number up. And it took a number of years, but you can see the steady progress. COVID was actually a great push, and we got to 40%. And we're still around this number today. We've now added looking at non-binary speakers as well, because as you can see, all the gender slides are very binary. But now with the self-reporting, we're starting to get more data than just, we can ask for more than just men, women. The next one, I won't go into a lot of detail on this slide, but this is just about self-reporting. So 2 things are important here. One is to get the right schema. And second, to try and get consistency in using the schema, right? Which is what we're doing with these, with the 55 other publishers. So we worked with a scholar to figure out what the right schema is. For gender, it's more straightforward. But we then expanded this effort to actually race and ethnicity as well. That's not easy to figure out a schema on a global basis. But together, again, with our peers, with other publishers, with the scholar, we decided on the schema. We started rolling this out last summer and increasingly added more and more journals. And today, all of the Elsevier proprietary journals now have this schema, and we're starting to roll it out to society journals as well. And I know that a few other publishers have already launched this too. So I'm very, very excited, because now we ask every author, editor, and reviewer to self-identify their gender, race, and ethnicity. And we already have, you can't quite see the numbers, but it's about 7 million for each data point. So we have 21 million data points. So very soon we'll be able to start producing analytics externally as well to look at gender balance by discipline, by country. Of course, it's all aggregated, but we can aggregate it in different ways. And that is exciting, because until now, I mean, always also for the gender reports, we've used algorithms to figure out gender, but really self-reporting is the best way forward. I talked already a little bit about providing analytics. Here are some examples of the gender reports that we've already produced using the databases that we have, primarily Scopus, which aggregates all publications, not just Elsevier's, and then our analytics group. And I can tell you next year we're going to put out a new one. The newest one will also have intersectionality. So we will look at the intersection of gender and other dimensions, and I'm very excited about that. And finally, this is about how we basically use our position, especially the Lancet, to publish commissions, reviews, organize summits, and webinars, really to elevate awareness to where women are, especially the Lancet in healthcare, but really inclusion in science and research and healthcare. So I mentioned that we look at gender, but also other dimensions. So I'll just give you a quick flavor of what else we're doing. So across Elsevier, the executive team, we prioritize 5 dimensions of diversity that we want to focus on. Gender, race and ethnicity, LGBTQI, disability, and generation or ages. For each of these, we have an executive sponsor, a business champion, and an HR partner, and we try to drive change both internally at Elsevier and externally. We also have about 30 employee resource groups, or ERGs, who we collaborate with as well. And on the bottom, you can see, at least internally, psychological safety and inclusion are very, very important for us. We believe without inclusion, there's no diversity. Actually, one of the things we monitor is what it is overall, but also in my gender task force, I monitor the gap between men and women on these two. And actually, on psychological safety, we don't have a gap. On inclusion, we still have a little bit. But on overall satisfaction, we still have a small gap as well, which is interesting and unfortunate. So we're working on that. And every month, at least in my gender task force, we have this, this is our OKR dashboard, Objectives and Key Results dashboard. On the left are the internal metrics, on the right are the external metrics, and whenever we meet, we look at this and we talk about why do we have red, why do we have amber, should we change our strategies, should we do something differently? I won't go into detail because there's a lot here. Okay, so the Elsevier Foundation is really why I'm here. They are one of the sponsors for today and tonight, and really a very, very important vehicle for us to drive especially the career progression element by partnering directly in many countries in the world. In fact, this year, right, we launched a new portfolio of initiatives in 5 countries. Let's see if I remember: Singapore, Japan, the UK, the US, and Germany. Here, right? Very excited about this. So the Elsevier Foundation really focuses its initiatives on inclusive research and health. About 80% of the work is around the sex and gender dimension in science, which is great. And of course, the Falling World's Female Talent Program is a very important initiative for us, and it's so rewarding to be here today. And I think all of you guests here are inspiring scientists, hopefully leadership of the future. And yeah, it's great to have you here. So I'll finish just by saying, this is a journey. We're making progress. We'll continue to try different angles and different initiatives. And by the way, if anyone has ideas, let me know. And we need to partner. It's not something, a systematic change like that, it's not something that a single party, wherever it is, can impact on its own, right? So we do need to work with stakeholders in academia, government, policymakers, and yeah, everyone around us. But it's exciting to see results, and it's exciting to be part of this journey. So thank you. I think I only have 5 minutes, I was told, to take questions. 2 minutes. Okay.
Hello. My first question is the demographics, the distribution of gender. When you say it's the US and then in general, is it the global South including or just the global North?
The first slide that I showed is global. It's all the researchers in our database.
Okay. And the second question, the schema you started preparing, race, ethnicity, this is only reflected in countries in the global North and not by geographic distribution? No, this is
everywhere. That's why it was so challenging to develop, right? Because minoritized group in one country might not be in another country. So it's more about self-defining what is your race, what is your ethnicity. I think we made it publicly available, actually.
Okay. And what about efforts to change societies which are still very much male-dominated, where women are strictly supposed to choose between a career or between becoming mothers? And this happens a lot in the global South.
Yes. Not easy, right? What we can do is try and help with career progression and try to elevate the problem and the differences between global South and global North, and we do more and more for that. We are actually increasingly talking, so although the board has asked us to do more, to look more at global South versus the rest of the world, so we are starting to do more of that. But yes, I agree with you, it's a big societal global problem.
Even in terms of research interests, you're going to find a very big gap between what people are working in the global South, things that are still very current, but they're no longer current in Europe, like HIV, for example, TB, Hep C. These are viruses that are no longer much more discussed or widely funded, but they still matter in Africa, in Asia, and Latin America. And I know several female scientists who are working in these areas, and they really have hard times, even when they want to apply to conferences internationally. Yes, thank you.
Thank you very much.
Hi, thank you very much. I find it very fascinating how much progress you have done. One of the topics that I felt I missed, though, was that an important topic, and touching also on what Marva said, in career progression, especially for females, is parenthood. And so my question was, I mean, we're here being encouraged, but we talk really little about what happens and what are the struggles that we faced. And actually, there's data showing that 30% of mothers leave academia and science overall. So my question to you is, are you planning into including motherhood or parenthood into one of these very nice categories that you showed us? Or, yeah, what are your thoughts on that?
It's a very interesting question, and I would love more input on how we might be able to include that, right? Because it's not something that comes out of data sets. So what is I guess we can, at least internally, we do, it is actually one of our categories. We'll look at where do women drop off, right? So absolutely not just women actually, parenthood, right? So we've updated our parental policy and we're looking at reintegration ways. And the other point is actually menopause, where we're starting to do more and more to support, because that's another phase where a lot of women leave the workforce. I think externally, as we think about our communities, I'd be very interested in any ideas you might have on what we can do, what we can do to address this.
Yeah, we can talk over lunch.
It's a great point. Can I take another question? Is that right?
I think so. I'm just gonna go ahead.
Okay.
Yeah, nice talk, and I think great you're collecting this data. I have a more radical question. So it's known that research and grant applications, but also journals, become more balanced if you do it anonymously. So have you ever considered submitting and reviewing, both by the editorial board as well as the reviewers, making this an anonymous process? Because we also know that more women in editorial boards doesn't automatically mean, like, we're not always very supportive to other women, so it's not necessarily pulling that forward.
Yeah, that's.
I'm wondering if you ever consider that.
I think we not only considered but also tried it, and people kept trying to figure out where the submission came from, which was not great. I don't remember. I think the results were not very compelling, actually, in terms of the difference.
That's interesting.
Yeah.
I know from some grant applications as well as more computational science journals where they really solve the whole problem by doing it this way. But yeah, indeed, if it's easy to figure out where it's coming from, then yeah.
It depends. In some areas which are quite narrow, you can deduce. But it's a good comment, and I will pass it on. I'll investigate if we still do it and where.
Many thanks, Mirit.
All right. Thank you so much. Thank you.